Welcome to Chapter 2 of the American Healthcare System. My name is Jeremy Whitaker, and this chapter is about the Affordable Care Act. This was signed into law just a few years ago and will be going into effect through next year. And the goal is to bring the insured population up to about 94%. Now, 100% is impossible because people will be always transitioning between insurance, switching jobs, so it's not uncommon for people to have breaks in their plan of a month or two, but generally speaking, keep it up pretty high in the 90s. Now, again, the four goals of the Affordable Care Act: keep people with consistent coverage, force employers to provide health insurance to full-time employees, slow the healthcare cost, and improve the quality of care. So again, some requirements that employers must provide coverage. Employees who have 28 hours or more per week, so right around that three-quarter time mark. It also forces them to combine part-time jobs to create more full-time jobs that then have healthcare benefits. If you're self-employed, you must either go buy insurance in the marketplace or pay a penalty that's referred to as a tax. There's a link there underneath to an explanation about health insurance marketplace. It's about a 2-minute video. It's going to do a great job of explaining it to you. Then the 3 levels that are offered. And then it removes pre-existing conditions clause for children. It also allows children to stay on their parents' policy up to 26 years old, which is great for young adults entering the workforce, that they can basically stay on their parents' coverage for longer. It includes, on page 31, you'll see the 10 essential benefits. You'd be surprised that a lot of plans prior to the Affordable Care Act did not cover these things such as mental health benefits and maternity. When I worked at Wellmark, a lot of employers would not cover maternity for dependents. So if a 17-year-old daughter got pregnant, they wouldn't pay for the birth of that child. It expands the Medicaid and the Children's Health Insurance Program for low-income children, and helps close the donut hole. Now, as you can see in those 3 bullets, at first there was almost a $4,000 gap between $22,830 and $6,440, where seniors had to pay 100% of their prescription costs. Now, as you can see, that gap is only about $1,500, and it should be completely closed by 2020. Now, it also changed healthcare, and it created the Independent Payment Advisory Board, which advises reimbursement for Medicare, which is, again, the biggest single payer of health insurance in the country. It created the Center for Medicare and Medicaid Innovation, which is, again, trying to bend the cost curve, accountable care organizations, value-based purchasing, and also coordinated care, which helps people navigate the healthcare system, hopefully reduce the number of labs and unnecessary testing. Created Independence at Home, the National Prevention Council, and again, the Healthcare Workforce Commission. And it also expanded 340B programs to critical access hospitals. 340B programs are discount pharmacy programs. Now, to critical access hospitals in Iowa, about 3/4 of our hospitals. So it's hospitals with less than 25 beds. So again, a large number of them. In fact, a lot of Iowa hospitals converted their hospital beds to long-term care to hit that 25 and under threshold, and they get better payments as a critical access hospital. The Affordable Care Act also started the Physician Compare and Nursing Home Compare websites, which allows you to compare statistics and quality between providers. So assignments for Chapter 2, there's an introductory quiz that's over the syllabus and the schedule, the course expectations document, and my contact information. You do have to schedule a meeting with me before the 2 weeks is out, preferably somewhat toward the middle of the module. There's an assignment if you pick the most important of the milestones. There's four of the milestones out of the 4 categories. And assignment 2 talks about the quality initiatives that are part of the Affordable Care Act. And there's a journal article that you're going to read and answer some questions over. If you have any questions, feel free to contact me.